And now for the former Minister of Health, the Honorable Dr. Bheri Ramsaran.
Thank you, Mr. Chair. I think you meant former Minister of Health.
I think that's what it says.
Okay, so thank you for that. Now, Mr. Chairman, the budget 2025 is radically transforming Guyana. It is also modernizing Guyana. But before I go into that, I'd like to remind you that the budget is a costed plan, whether it be a budget by a housewife or a shopkeeper, but more so the budget by our glorious Minister of Finance, Dr. Ashni Kumar Singh. But what I like to point out, it's not a single man job, it's a team, thanks to the team. But before I get there, Mr. Speaker, I ask you to allow me to make some observations and make a little diversion before I delve into the theme of the matter. And thank you for reminding 20 minutes. Mr. Speaker, before delving into my brief analysis of the budget 2025, allow me to make these few observations. I think it was yesterday and earlier today it was reinforced. There was an observation of malnutrition in childhood malnutrition, to such an extent that I thought I should, as former Minister of Health 2 times, and supporting the new Minister of Health, the incumbent Minister of Health, that we should tackle it. Because it's misleading, and we think it's the misleading nature of it is very deliberate. Mr. Speaker, so before getting into the budget itself, let me make these observations. The malnutrition scare, the malnutrition in childhood malnutrition that was pumped up by certain members of the opposition, is based on misrepresentation of facts. This misrepresentation is due to ignorance of the real situation or to a deliberate effort to misinform the nation. I think you'll all remember what I'm...
Honorable Member, please don't impute. Imputing, deliberate attempt to mislead. I can get the quote.
Okay, my apologies to anybody offended. Yes, Mr. Speaker. So I think we should look at that and put the facts straight. In just in case there might be some misunderstanding as to the real intention. It can nevertheless bring forward a misinformed position which we need to counter. I believe that this is indeed could be misunderstood as being calculated, and as you pointed out, I would not like to use the word disingenuous, but it might be miscalculated by the media and by the audiences, uninformed audiences, that was what was meant. The infinitesimally increase in childhood malnutrition by a factor of some 0.000 something is inconsequential, while we must note it as humanitarians and as medical practitioners and as generally as public health leaders. The truth be told, infant malnutrition ceased to be a problem in mid-1993. In mid-1993, if I remember, my memory serves me well, when the Georgetown Public Hospital Corporation Malnutrition Ward, which was inherited by the new era PPPC administration, inherited from the PNC dictatorship, was closed, permanently closed, as was the so-called malnutrition clinic at the said hospital. In other words, we actually had a malnutrition ward in the Georgetown Hospital, overpacked, and we had a clinic. The clinic, not only the ward was banished and dismantled and gotten rid of and closed, but the clinics themselves. What is more, we must observe that this was also the case, that is the presence of these clinics and these so-called malnutrition wards was also widespread on all the hospitals across the nation, nationwide. These wards and clinics existed under the PNC. The same people, where they're gone, banished, don't like to hear the truth. So, Mr. Speaker, please allow me to spend some time not repeating but reinforcing the point. And they vanished, these clinics and wards vanished under the PPPC. They were usually referred to, or the condition malnutrition was referred to as locally as wapia or white mouth. and in the literature as 𝐁𝐔𝐃𝐄. The late Dr. Anwar Hussain worked in that clinic. So did Dr. Jennifer Westford and I. Childhood malnutrition is not currently a public health problem. I want to use this budget debate and this simple example to call on the opposition MPs to stick to the facts. Stick to the facts. I also want to caution unsuspecting Guyanese, especially supporters of the PNC, now rebanded the APNU. Beware of the subterfuge. In this regard, and through you, Mr. Speaker, and in direct reference to the Honourable Member of Parliament, Ms. Fernandes, who made a somewhat amateurish attempt at analysis, I'd like to caution Guyanese. Beware of pretty faces and melodious voices peddling confusion. Most of the ladies sitting on the opposition benches are hopelessly confused. And so too, Mr. Chairman, Mr. Speaker, are most of the gentlemen too. Beware of the APNU confusionists. Beware of the APNU confusionists. Look how they were trying to slip in this little misinformation. And it would have drive the wedge, this misinformation, misinform not only the public, but our developmental partners. They could very well would have thought that we were fooling them when this misinformation came out as if it was fact. No budget is perfect, Mr. Speaker. I'm paraphrasing another speaker who went before me a few hours ago. Mr. Speaker, no budget is perfect, and this one is no exception. It is admittedly though only near perfect. I clearly admit it's not perfect, but let me with all modesty say it's near perfect. It is our duty as legislators not to settle for good enough, but to demand more equity, more inclusion, and more action. Our collective duty as legislators is to promote progress and prosperity while pushing for better outcomes. This budget 2025 is that costed plan crafted to achieve these lofty goals within the constraints of our current resource-deficient circumstances. In other words, the minister and his team has put forward a good budget, a good document, while at the same time not hiding from the fact, not hiding from us the difficulties and the constraints they had. Congratulations, Mr. Minister. Congratulations to your team. The truth, transparency.
You are absolutely correct.
I commend. It generates hope. It opens opportunities for personal and collective security and reward arising out of hard work. Work hard within the constraints and your government will support you. The government will try in every way to leverage ways and means of giving your effort even more power, more resources, and more reward. In other words, this budget generates hope. I commend this budget as presented and endorsed this in August House. Onwards, upwards, may we have a glow. Repeat it with me, friends. Onward, remember that famous song? Onward, upward, may we have a glow.
Onwards, upward, may we have a go.
May we have a glow. Oh. Now, a costed plan, as I said, a budget is a costed plan. And the costed plan presented here today for and the past few days for your scrutiny supports our manifesto. Our manifesto to the people, a promise to the people when we went for their vote, is a social compact, a social contract between them, the voter, and we, the people looking for their votes. So the manifesto is clearly supported by this budget. In other words, it is planned. It's a planned policy. You're not just plucking things out of the air. Dr. Ashwin Kumar Singh and his team, his hard-working team of public servants, skilled and some of them not very old. There's a bunch of young people there too, we must note that. They're giving solid support to the manifesto promises. And it shows the continuity from where we come. We're building on what we have already achieved. A next note coming from one of our contributors is the budget covers everybody from cradle to grave. Mr. Ramjatan jokingly, and I must, since I want to put another issue on the agenda, on the front burner, men's health. Mr. Ramjatan could very well be putting us into a little bit of problems. He made some. I saw he leaned over and got permission apparently from Mr. Norton, his boss, when he tried to make that joke. He was trying to say that I think he said something to the effect that the budget, or there must be concerns from erection to resurrection or something like that. But let me tell you, this budget does that already. In a real healthy sense. And Mr. Ramjatan should visit his health center. He lives in Campbellville, I think. The Campbellville Health Center is one of the most organized, praise them, public health workers, public health nurses, one of the best in the country, if not in the region, for its vaccination program. And there we will be introducing men's health. And I hope I can make the speaker will allow me to make a demonstration. For the first time ever, we're going to be pushing. Formerly it was women's health, child's health. We love that. We won't give it up. Guyana has one of the best rates of vaccination in the world, if not the best. About 96 to 98% of our kids who need vaccinations in that stage of their lives against vaccine-preventable diseases are vaccinated. In some bigger countries, some of them neighboring, some of them very bellicose, some of them very warlike, they have only 39 and 40%, sometimes barely 50%. Guyana leads. We are among the best. We are among the best in the world. So we're going to be adding, that was women's health. And I think Ms. 𝐃𝐄𝐁𝐃 did a lot in the past. I'm not trying to butt her up because she's my chief whip, but she did a lot with severe circumstances, resource constraints. She put that on the agenda too when she was Minister of Health several years ago. As a matter of fact, the same decades ago, time does fly. So she was able to put on the agenda expanding the vaccination program because vaccines save lives. Vaccines prevent the spread of disease. Guyana is in the top ranking among those countries with vaccination program. So there was a kind of bias for maternal and child health. Now we're not saying we're going to get rid of it. We're going to continue that strong forward momentum leading the Caribbean. Guyana is big brother in that regard. But what we're going to be doing, we're going to be begging pardon of the men who we seem to have neglected over the decades. We're going to be putting what? Men's health, Mr. Chairman, Mr. Speaker, on the agenda. That is one of the tidbits, one of the seemingly small things I want to mention. And Mr. Ramjatan's effort at a little bit of an off-color joke prompted me to put some sense and into the nonsense he was trying to evoke. And I was very much, did you see it? Must run back the footage. He actually had to lean over to his boss, Norton, to see if he could have said that big man joke, you know? But indeed, it's a problem. It's a problem. Erectile dysfunction can be first indication of several other diseases. Definitely. So don't laugh at it. Especially those ladies who have husbands and they might be knowing some of the secrets. It might be the first indication of cardiac issues, other issues, and so on. Definitely, because it's all interconnected, right? If you can't perform in one degree, definitely you might be compromised in other degrees. So men's health now will be one. I would like to take this opportunity to put men's health on the agenda. And what we're doing is making it not as an alternative to women's health, but saying when you take your wives to the clinic, when you take your children to the clinic to have themselves looked at in the maternity section, stay there too. Men's health must be on the front burner now. Get your pressure checked. Get your sugar checked. Get your blood count done. So those are things we want to do. For example, are you 45 years and over? Those are already things you got to be looking at. Too many men have prostate cancer and prostate disease, but because it's slow acting, slow in its development, and because it's such a so-called shameful, we don't talk about it. I see the people over on the opposition benches shaking heads with me. Let's come together. These are the things that unite us. Erectile dysfunction can definitely unite us. So let's unite in those things. And in other aspects. What about this? I said vaccines save lives. But Madam Teixeira, blood too saves lives. We can come together, and this parliament has done it before. Joint blood drives to show that we are definitely with the people. And the budget, this is not diverting from the budget. The budget provides for these certain expanded services. But let me shift on more to the budget. 6 new hospitals. I don't want to intrude onto my minister's purview because he is going to be piling it on. But I want to tell you, this is building on a foundation. Remember, it's under the PPP that hospitals were made left, right, and center. Diamond, Leonora, Saudi, Maikoni, Port Morant. For the first time ever on the East Bank, there was a hospital at Diamond. Yes, like Leonora, but let me speak a little bit on the East Bank. For the first time ever, there was a hospital there. Previous to that, you had to go to 𝐁𝐔𝐃𝐆𝐄, the 𝐁𝐔𝐃 dispensary, where more often than not you are given a green sludge as a cure for all with some Panadol. And not only that, only workers and their close relatives could make benefit of that service. So when we did, and that was under the Jagdeo presidency, when we did make a hospital there, it was a boon. As I used to say, Diamond was a gem. And I meant Diamond, the location, Diamond, the hospital. And now we will be making not only Diamond, we're putting pearls there now. We're going to be putting a massive new hospital in the vicinity. And Diamond, the...
Honorable member, to continue this gem of a presentation, you'll need an extension.
Thank you, Mr. Speaker. Can I ask that the honourable member be given another 5 minutes to conclude his presentation?
Thank you, Mr. Chishira. Honorable MP, you may continue.
So there are many things that happen in the health sector, and I diverted a little bit. I got a little flustered with that. But we are building on what we constructed, what we did. And then remember, the Diamond facility will not disappear. It will be retrofitted and still pressed into service for the expanded services of the health sector. It might become a rehab center. So whereas we had just a small little hospital on the East Bank corridor, you'll be having a massive hospital, one of the 6 hospitals, and as Dr. Anthony will tell you later, one of them will be specializing in what? Maternal and child health. So the infant mortality will go, we know it will never meet 0, but it will approximate to 0. And that again is the next thing we must boast about. I remember in the first 5 years that I became Minister of Health. First year we lost 25 maternal deaths, we had 25 maternal deaths. Then the next year it went to 21, then 19, then down to 11, then down to 6. And what's more, and that again is when we speak about some of the deaths, the infant deaths and the different things like malnutrition. Some of those maternal deaths were what you call direct and indirect. In 1 January, unfortunately, there were two women died. The only 2 deaths, maternal deaths for that January. One had severe malaria, black water fever, what you call cerebral malaria, and one had advanced stages of HIV/AIDS. So what did they die from? The AIDS or the malaria? Under the conventions, medical conventions, and Madam Chishira can tell me that this is so too, or reprimand me if I'm making a mistake. It means they will go down at maternal deaths. So in that January, you had 2 maternal deaths, which in my opinion, or in the opinion of someone, had nothing to do with the maternity state. As a matter of fact, if you're pregnant, or if a woman is pregnant, and of course only women can be pregnant until now, if you're crossing the road and you get run over and you die, it's a maternal death. So those are some of the things we look at. So when you're talking about malnutrition too, Guyana does not have a problem with malnutrition. In other words, Maga Picnic, White Mouth Picnic, that days are gone since we got rid of the PNC 92, 93. They're gone. Them clinics got to close down. I was part of that process. Dr. Westward was part of that process. What we have now is a pandemic of obesity, childhood obesity, juvenile obesity. We need to look at that, and the Ministry of Education has to take note of what I'm saying. The canteens policy, too many sugary beverages being sold in the school canteens. We've been making some efforts for the past some time to have cooperation, and I'm happy to announce that Madam Minister of Education is very cooperative and helping us. Canteens policy. We've been able to ban smoke and tobacco from the schools and the school environment, even advertising it. We've been able to ban alcohol and advertisement of alcohol from the schools in the canteens and even nearby. So why can't we do something about sugar? White death, the poison, the white death means salt, and now the sugary death being the next form of death. The canteens policy. So I want to point out again that the Minister of Education is very gung-ho on this, a very progressive lady indeed, because canteen policy, because she, of course, has been a mom and knows what I'm speaking about, being enlightened, and in the past was already cooperating with 2 ministries, 2 powerful ministries coming together for what? For the future of the country, because we having too much juvenile diabetes emerging, and as I said, we have not a pandemic, not an epidemic, but a pandemic by now, a pandemic of juvenile obesity, which is one of the cornerstones for development into other diseases, cardiac diseases, for example, and even diabetes itself. So those are some of the things we wanted to speak to you about. And at the same time, I want to fade out, Mr. Speaker, with putting men's health on the agenda. We've done well in maternal and child health. We've done health, so we need. I think they realize they're beyond health. Some of them are beyond health. I think they recognize that, Madam Chair, Madam Minister. So, Mr. Speaker, thanks for giving me the extra time. And I'd like to close by saying, Guyana has done well, but this budget will put us in a position to do even better. Let's thank again the minister, let's thank his team. And let's repeat, there's 6 new hospitals, including one for maternal and child health, specialized. As a matter of fact, we need more staff. We might be even in the initial stage have to import them. And not that we've been anti-Guyanese, we've been realistic. Remember when we made on the Jagdeo, the Diamond Leonard study, Maikoni Portmont, we had to bring in Cuban specialists, but we used them in a double capacity, not only as technicians and clinicians in these facilities, but as teachers, as professors. We were able to bring back the students we had sent to Cuba, the 1,000 students, and bring them back 1 year early and had them inducted, and they continue training here at those Diamond Leonard study, Maikoni Portmont, under the tutelage of their professors. Similarly, we're going to be having 2 additional training centers for nurses, one in Saudi and one in Port Moran. My apology, and one in New Amsterdam. Well advanced, unfortunately, due to certain shortage of building materials. Again, due to the fact that there's so much building going on. I see that Dr. Anthony is shaking his head. That we're competing, construction sites competing against construction sites for sand, for bricks, for stone, and for steel parts. For metal. So we're having those 2 massive. As a matter of fact, I can put you in the little know. It's the one in New Amsterdam is being constructed on an empty plot that was left after the dismantling of the old New Amsterdam Hospital, which was then relocated a few years back to the new location near the mental hospital, near to the bridge, the Kanchi Bridge. So things are happening. Not only are we building facilities to house the patients and manage the patients and treat the patients, but we're creating modern facilities where nurses can be trained. And not a nurse teaching a nurse, not an old nurse teaching a nurse, but with equipped classrooms, technically equipped, where you can have sessions showing them how to do the actual mock-up sessions. Simulation, I think it's called. I'm missing, what's the word? Simulation centers. You see, I'm getting a bit, it's late in the evening and I'm getting a bit tired. So, Mr. Chair, thank you for that. Thank you for the opportunity to be able to explain to you. And this, I recommend this budget wholeheartedly. This budget will keep us stay in the course for better development and propelling Guyana into the future, modernizing Guyana. Thank you, Mr. Speaker.
Thank you very much, Honorable Member, Dr. Bheri Ramsaran.